Assalamualaikum warahmatullahi wabarakatuh. I am Lmce from Group 3. Our group will be discussing about the ongoing issue, which is the pandemic of COVID-19. Our topic is COVID-19 pandemic and mask. We want to create awareness in wearing masks by stressing out the types of face masks available and its effectiveness, also its importance and the guidance in wearing face masks. Since the outbreak of COVID-19, face mask has become one of the essential items to protect ourselves from the spread of COVID-19. On July 23, 2020, following the re-emerging cases of COVID-19 in Malaysia, Datuk Seri Ismail Sabri Yaakob has announced the implementation of mandatory mask wearing in crowded places. Up until June 2021, COVID-19 cases has spiked up to 1,000 cases per day, which also led to Movement Control Order 3.0. On May 22nd, the Health Director General, Datuk Dr. Noor Hisham, has encouraged the public to wear double face masks in crowded public spaces and also high-risk places, such as in the hospital. This movement of implementing and encouraging the wearing of face masks has shown how crucial it uses in preventing the spread of COVID-19. In order to do or to urge people to do something, including wearing face masks, I am strongly sure that the people and also us must know the big why. The people must know the big why. Why must we wear the mask? The answer is simple. Because face masks help to protect and prevent ourselves from the spread of COVID-19. And this led to the question of how does face masks help to protect and prevent ourselves from the spread of COVID-19? CDC, the Center for Disease Control and Prevention, has summarized the events or ways of the transmission of SARS-CoV-2, which is the virus that causes COVID-19. According to CDC, there are three principal ways of how one can be exposed to virus. Firstly is by inhalation, which means the action of breathing in of fine respiratory droplets and also aerosol particles. Secondly, the virus can be transmitted by the deposition of respiratory droplets and also particles on exposed mucous membrane. Mucous membranes here are mainly referred to the nose and also mouth. And lastly is by touching mucous membranes, which are the nose and mouth, and also the eyes with hands that have been soiled directly by virus containing respiratory fluids or indirectly by touching surfaces with virus on them. There are also some restrictions involved in the implementation of wearing masks during this pandemic of COVID-19. According to World Health Organization, WHO, face mask is not recommended to be worn by children younger than 2 years old, and also by person with trouble breathing, and anyone who is unconscious or unable to remove the cloth face covering without assistance. It is also important to not share your mask with anyone else, and it should be replaced with a new one as soon as it is damp, and do not reuse single-use masks. Keep the mask away from you and also the surfaces while removing it, and immediately discard the face mask after use, preferably into a closed bin. You also need to remember to always wash your hand before and also after wearing the face mask. And this will keep the hygiene for sure. As a conclusion, I believe every Malaysian should play their role in putting the effort and also be united to fight against this pandemic of COVID-19. Bear in mind, masks are not a replacement for physical distancing, hand hygiene, or other public measures. So, it is not only important to wear face masks, but also to comply with the SOP as well. Stay home, stay safe. Thank you.
Hello everyone, I'm Jenny from Group 3 and my matrix number is A167796. In this video, we'll be discussing a topic regarding the COVID-19 and masks. The COVID-19 pandemic triggered a surge in demand for the face mask to protect against disease transmissions. The Centers for the Disease Control and Prevention (CDC) has recommended people to wear masks in the public settings and anywhere they will be around other people. Nowadays, people are wearing different types of the face coverings, including the handmade cloth mask, the disposable surgical mask, and N95 respirators. But what are the differences between those face masks and when should they be used? First and foremost, the cotton face mask. It may or may not meet the fluid barriers or the filtration efficiency level. According to an article published in the Journal of Family Practice, the single-layer fabric masks are less effective than the double-layer mask, which is more or less effective than triple-layer masks. The single-layer mask may only provide 1% of the particle filtrations, whereas two-layer mask filters about 35% of the small particles. The effectiveness of the cotton face mask largely depends on its constructions. Adding a polypropylene filter to the two-layer mask may increase the filtration efficiencies from 35% to largely 70%. The cotton face mask should only be considered for those without symptoms in areas where the COVID-19 is widespread. They may also can be used by the general public under the age of 60s and who do not have the underlying health conditions. Secondly, a surgical mask. It's a loose-fitting disposable face mask that helps to block the large particle droplets or spread that may contain the viruses or the bacteria. According to a study published in the year 2013, the surgical face mask can filter out about 60% of the smaller inhaled particles. The surgical masks are made in different thicknesses with different abilities to protect you from COVID-19 transmissions. For instance, 3-ply surgical masks are composed of 3 layers of the synthetic non-woven materials configured to have the filtration layers sandwiched in the middle and have a various level of the fluid resistance and filtration. Surgical masks are recommended for those who are feeling uncomfortable, including the people with the mild symptoms such as cough, sore throat, and fatigue. The surgical masks are also recommended for individuals who have a higher risk of becoming seriously ill with the COVID-19 and those with underlying comorbidity. Furthermore, an N95 respirators is a respiratory protective device designed to achieve a very efficient filtration of airborne particles. The respirator is intended to prevent the specific diseases or infections by filtering out at least 95% of the airborne particles, including the viruses or bacteria. Note that the edge of the respirators are designed to form a seal around the mouth and the nose. Hence, there is a minimal leakage occurs when there is properly fitted. N95s are commonly used in the healthcare settings and should be reserved for the healthcare workers who provide the care to the COVID-19 patients. However, it is not recommended for the people with the chronic respiratory cardiac conditions or breathing difficulties because the N95 respirators may make it more difficult for them to breathe. In a nutshell, it's crucial to determine the differences between each kind of the face mask to know which is the best mask suits you. Thank you.
Hello everyone, I'm Lmce from Group 3 and my metric number is A172314. In this video, I will be discussing the current issue which is COVID-19 and masks. Face masks has quickly become one of the essential items in life, almost like what a smartphone is to us. Recently, the mutated version of the novel coronavirus spreads much easily compared to its first detection back in December 2019. WHO classified the SARS-CoV-2 variants into variant of interest and variant of concern. Among the numerous variants, SARS-CoV-2 Delta variant of concern has become the dominant strain. This variant is a more virulent strain and has a higher transmissibility that threatens our health. So, what should we do now? Since COVID-19 has upgraded its itself, we must also step up our prevention measures. Thus, this brought us to the topic of double masking as well as knot and tuck masks. What exactly is double masking? Double masking means wearing one mask on top of the other. The rationale for double masking is to fit the mask better to our face. The outer layer provides a pressure that seals the sides, leaving no space for unfiltered air to enter. Apart from that, the double masking has a better filtration level towards the virus-containing respiratory droplets. On the other hand, knot and tuck is a method where we create a knot at the ear loop of both sides of the surgical mask, subsequently tuck in the extra materials under the mask edge. This helps to fit the surgical mask better to our face than an unknot mask. In February 2021, CDC has conducted an experimental simulation to determine the effectiveness of modified methods to wear a surgical mask in reducing the exposure to respiratory droplets. The result demonstrated that double mask and knot and tuck method blocks around 85.4% and 77% of the cough particles respectively. This is a significant increase in efficacy compared to the 37 to 69% efficacy range of the surgical mask alone. With all that said, how do we wear two masks on our face? First, wear a disposable mask as usual, followed by a multi-layer fabric mask as the outer layer. Make sure both masks fits your face contour properly. Remember, do not use the same type of mask. They are not a good pair for double masking. As for mask knotting and tucking, the first step is to fold the mask from edge to edge. Tie a knot at each side of the ear loop and push them close to the mask edge. Next, tuck in the extra materials of the mask into the mask edge. With that, the knot and tuck mask is ready to be worn over our nose and mouth. Although vaccination boosts our immunity against the COVID-19, we are still not invincible against the virus. Maintaining social distance and wearing a face mask is vital for everyone. Stay safe, wash your hands, and wear a mask at all times. Thank you for watching.